Imagine your loved one is too weak to get out of bed. Their muscles sore, their joints too weak. They rely on you for everything. They feel as if they aren't even living anymore. Because of this, they've recently started talking to you about speaking with their doctor about physician assisted suicide. You're unsure if this should be legal, but your loved one is adamant that this is what they want. Physician assisted suicide, or PAS, is currently a highly controversial topic, with many believing it should be legal and many others believing it should not. I've extensively researched both sides of the issue and now have the knowledge to inform you of both sides. Unfortunately, there is a good chance that you will be impacted by this someday, whether it be you, a significant other, a family member, or even a close friend. It is best to be knowledgeable before you ever have to make a decision. Like every issue, there are always two sides to everything. For the next few minutes, I will highlight both the pros and cons of physician-assisted suicide related to the Hippocratic Oath, the effect on different social groups, and patient suffering. As I said before, there are people who believe PAS should be legal and those who think it should be illegal. I'd like to first start off by talking about the reasons people believe it should be legal, or in other words, the pro side. Over the next couple of minutes, I will discuss why the Hippocratic Oath is not important, different social groups are not at risk of being abused, and why patient suffering is relevant when discussing making PAS legal in all 50 states. Before we start, let's define what the Hippocratic Oath is. According to dictionary.com, the Hippocratic Oath is an oath embodying the duties and obligations of physicians. Many medical schools will recite parts of it at graduation. The Hippocratic Oath is not important when deciding whether or not PAS should be legal. According to procon.org, the Hippocratic Oath has been modified numerous times. For example, women used to not be able to practice medicine. Clearly, that's not the case anymore, as there are many female doctors, nurses, and other members of the healthcare community that are women. It also used to state that doctors could not cut skin or break skin. That's done every day, whether it be IVs, vaccines, blood draws, surgery, you name it, they do it. One of the most famous lines from the Hippocratic Oath that I'm sure many of you have heard is "do no harm," but this too needs explanation. Dr. Philip Nitschke is quoted as saying, "Does not doing harm mean that we should prolong a life that a patient sees as painful or a burden?" The real question is, which causes more harm to the patient? Forcing a terminally ill patient to suffer and live, or allowing them to die peacefully? This is what it comes down to with the Hippocratic Oath. Next, let's discuss why different social groups are not at risk of being abused. When looking at data from places that allow PAS, Dr. Nicola Biller-Andorno noted that as long as safeguards are in place, legalizing physician-assisted suicide does not lead to uncontrolled expansion or abuse. Another doctor in favor of PAS is Dr. Linda Ganzini, who also holds a master's in public health. She also stated that different social groups are not at risk of being abused. She found that a majority of those who chose PAS were college graduates, most likely Asian, usually younger, and more likely to have cancer or amyotrophic lateral sclerosis, otherwise known as Lou Gehrig's disease. She also found that minorities such as African Americans are usually more often socially disadvantaged, but in Oregon, they make up 2.6% of the population, and none of them chose to go through with it. This clearly shows that they are not at risk of being abused. Finally, let's go over why patient suffering is relevant when deciding if PAS should become a law. Faye Gersh said, "Americans should enjoy a right guaranteed to those in the European Declaration of Human Rights, the right not to be forced to suffer. It should be considered as much of a crime to make somebody live against their will as it is to take a life without consent." Physicians' role is not just to preserve life. It also includes applying their expertise and skills to help improve the patient's health or alleviate their suffering. Obviously, keeping them alive when they do not want to be because of their suffering is not helping them in any way, it's just harming them. Copeland and DeVille also stated, "An important goal of medicine is to relieve suffering. Many of the best-known accounts of PAS cases were done by compassionate, kind, and considerate doctors who believed their duty was to assist relieving pain, anguish, and suffering, which was a higher duty to them than prolonging life." So now I've gone over different reasons as to why PAS should be legal in the 50 states. Regarding to the Hippocratic Oath, different social groups not being abused, and the relevancy of patient suffering. There are 3 reasons as to why PAS should never become legal. The Hippocratic Oath is important, different social groups are at risk of being abused, and patient suffering is not relevant. Let's start off by talking about why the Hippocratic Oath is important, whether deciding PAS should become legal. Dr. Leon Kass is not supportive of PAS whatsoever. He once stated something along the lines of, one of the first things you state in the Hippocratic Oath is that you will not give a poison or a deadly drug to anybody, whether they ask for it, and you will not suggest to give it to them. Clearly, this would be broken if a physician used physician-assisted suicide, as that would be breaking one of the very first laws of the Hippocratic Oath, which Dr. Leon Kass finds to be important. Another doctor against physician-assisted suicide is Dr. J. Donald Bordeaux. He stated that many aspects of physician-assisted suicide breaches the physician's long-standing ethical norms, basically the Hippocratic Oath. Do no harm is also important, which, like we covered before, is one of the most famous lines. Physicians that partake in PAS are indeed causing harm, are they not? They are leading to someone's death, which is harm. Now let's move on to why different social groups are at risk of being abused. According to the New England Journal of Medicine, PAS puts the elderly and disabled at risk. These groups have always been vulnerable, and this will increase that risk. Psychiatrists say that those suffering from old age or severe illness may not be in the right state of mind, and they could and would be abused by family members and or doctors. Finally, I will go over why patient suffering is not relevant when deciding if PAS should be legal or not. According to procon.org, those for PAS say laws against it are government-mandated suffering. But this claim would be similar to stating that laws against selling contaminated food is government mandating starving. Clearly, when the government says you can't sell spoiled milk, it's not to cause starving, it's for your health. The laws are in place to keep abuse from happening and to protect patients from doctors and others. They are not intended to cause suffering. Now that you've heard from both sides of the issue, it is time for you to decide where your opinion falls. As you are aware, there are arguments for both sides of the debate. For example, the Hippocratic Oath should be taken into consideration, but so should the patient's undeniable suffering. Regardless of the side you agree with, it is important to keep in mind the suffering that these patients must go through. As Pamela Bone once said, "I'm not afraid of being dead. I'm just afraid of what you might have to go through to get there."